I think there are many options. I'm
Yeah.
sure you are very familiar with the recent publication by Africa CDC on reimagining health financing in Africa, what we call the Green Book. I hope that you can share that with your viewers, because the Green Book articulates in a very clear and pragmatic manner the 3+1 pillars
Yeah.
that the continent should explore. As we say, the, the health financing crisis that our countries are facing now is also an opportunity. It's an opportunity to try new things
Yeah.
because the fiscal space currently is also constrained by the debt servicing.
Yeah.
So we need to quickly reprioritize, increase the allocation to the health sector, but it requires to have a much more wider fiscal space. So where are the opportunity to increase our fiscal space? There are three options that are coming from countries. I can tell you, it's, for example, a country like South Africa or DRC. They have applied tax on imported goods, also applying tax on civil servants' salary to support the national health insurance plan. Uh, and they are the very common tax that is now being applied also in South Africa. I heard about it. Is the same tax, the tax on tobacco, alcohol, and processed food. Those commodities that could also lead to ill health
Yeah.
should be targeted to leverage resources to support national health insurance plans in a given country, and also because they will also contribute to prevention.
Yeah.
Prevention, let's call it your prevention strategy. If access to those commodities is somehow a bit stringent or restricted. Now, what we don't talk about much is the opportunity that lies in the diaspora remittance.
Okay.
It's estimated that the diaspora remittance is outpass the amount of resources that the continent receives in terms of ODA, overseas development assistance. So that diaspora remittance, if we apply just a little percentage, let's say 1%, to the trillions that the diaspora transfer to the continent, we could secure significant pot of resources, maybe at continental level or at regional level. Nigeria, if you take the case of West Africa as a bloc, the diaspora from West Africa, if you just imagine how much we can leverage for an African regional initiative, which could be related to local manufacturing, which could be related to regional procurement
Yeah.
in among those 15, 16 countries of West African regional bloc. How much can we achieve? Or it can be related to the an insurance scheme for chronic care
Yeah.
or certain rare diseases. I think there's definitely an opportunity in the space of the diaspora remittance that African Union, Africa CDC, and member states will have to explore.
Yeah.
And it's also a way the diaspora could contribute to the transformation that is needed on our health system on the continent. CPHI is not only a scientific fora, it's also a fora where we have strategic discussions about the direction of travel that our political leaders should take. And what came out strongly over the past 2 days is the conversation around what do we mean by health sovereignty, and what are the critical ingredients that we need to secure if we have to be ready for the next shock, or first of all, to overcome the current high
Yeah.
financing crisis that we are going through. It's high time that we look at health as an investment rather than a spending. It's high time that prevention receives equal or even more investment than treatment, care, and support. The best investment is on prevention. And to make that investment, we need to invest more on primary health care because that's where you have the contact with your community. And that's where you can easily reach out to families and promote good practices and promote healthy behavior, not only for infectious diseases, but also for non-communicable diseases, because on the continent, we are facing the dual epidemic of infectious diseases and an emerging epidemic of non-communicable diseases. And prevention is the best weapon for those, especially for the NCDs. What is also clearly coming out is because we are going to use more and more of our own resources, the question of how do we put our resources into a system that builds our local economy is on the table. And this is where the local manufacturing becomes central to a conversation that makes health an investment that brings return. So, how do we promote local manufacturers? How do we pull the demand from the 55 member states to ensure that our local manufacturer they have business?
Yeah.
Demand is business, right?
Yeah.
So that conversation was also very central to the conversation around health sovereignty on the continent. But how do we do that in a way that we can serve the needs of the continent and the needs of the world? So we are also looking for quality product produced in Africa, not only for Africa, but also for the world. I think this is also an important dimension of sovereignty. Sovereignty is not about a self-sufficiency. It's also about global solidarity. And then the last point that also came out strongly is the digitalization.
Yeah.
And how can digitalization serve a health sovereignty agenda? It became clear during the discussion that the data is a tool for sovereignty. You don't If you don't know what you are doing, you won't be able to improve on what you are performing. And if you can't show what you are doing, you can make the case for more investment. So data becomes a critical point, and the digitalization will allow now the primary health care to bring information in real time on the table of decision makers through an end-to-end system which start at the community. Community health workers should receive a digital tool which allows them to not only learn about what they are doing, but also interact with the district or the health facility platform. And the health platform should bring in the community data, the facility data, and connect with a central national intelligence facility, which now be connected to a continental national public health interface or dashboard or repository. That's the vision for data sovereignty, and that's also one of the takeaway from this conference.